Good day everyone, I'm Lance Rancelo Soro from BSN3. For today, I will demo the NGT insertion. First, we need to know the assessment. 1. Assess the doctor's order, the client's level of consciousness and level of knowledge and understanding about the procedure. Availability and functionality of the needed materials. Check for the history of nasal surgery or deviated septum. Assess for patency of nares or nares, and determine the presence of gag reflex. Assess the mental status or ability to participate in this procedure of the client. Next is moving to the planning. In planning, before inserting a nasogastric tube, determine the size of the tube to be inserted with and whether the tube is to be attached to suction. We need the materials to be prepared is the large or small bore tube or non-latex preferred, non-allergic adhesive tape 2.5 centimeters, a pair of clean gloves, water-soluble lubricant, facial tissues, glass of water, and drinking straw. 20 to 50 ml syringe with adapter, basin. And next is the pH test or the pH test strip or the meter, biliberian dip strip, and stethoscope. Disposable pad or towel, clamp or plug, anti-reflux bulb for the air vent if some tube is used, safety pin and elastic band, CO2 detector. It is optional. Then moving for the implementation of the procedure, introduce yourself by verify the client's identity using agency protocol. For example, hello, I'm Lance Rancelo Soro. For today, I will be your student nurse. For today, may I see your wristband and identify your name. Next is assist the client to the high powers position if his or her health condition permits it, and support the head on the pillow. Place the towel or disposable pad across the chest. Perform hand hygiene and observe for appropriate infection control. Next is provide for client's privacy. Assess the client's nares and prepare the tubes. Support the patient with the procedure. Determine the how far you're gonna insert the tube. Use the tube to mark on the distance from the tip of the nose of the client's nose to the earlobe, and then from the tip of the earlobe to the tip of the tripod mark. This length will adhesive tape in if the tube does not have markings. Then insert the tubes. Lubricate the tip of the tube well with water-soluble lubricant or water to ease the insertion. Insert the tube with natural curve toward the client into selected nostril. Ask the client to extend the neck and gently advance the tube toward the nasopharynx. If the client's gags, stop the tube passing momentarily. Have the client's rest, take a few breaths, take a sip of water, and calm the gag reflex. Next is ascertain correct placement of the tube. Aspirate the stomach contents and check for the pH, which should be acidic, confirmed by the x-ray. Place the stethoscope over the client's epigastrium and inject 10 to 30 millimeter of air into the tube while listening for the whooshing sound. Secure the tube by tapping the bridge of the client's nose. Next is evaluation. Evaluate the client's response to the procedure and document the procedure and other important data of the client's chart.